Hi, my name is Eric. In this session, we're going to talk about injury in the backcountry, and I'm going to share some thoughts on prevention, what to bring, and the critical first steps in case something does happen. The first thing I'd like to talk about in the area of prevention is the traveler's mindset. And to illustrate that, I would like to read an essay from one of my favorite books, The Art of Living by Wilfred A. Peterson, published in 1961. This essay is entitled The Art of Traveling. When you pack your bags to explore the beauties of your own country or to travel around the world, consider these keys to a happy journey. Travel lightly. You are not traveling for people to see you. Travel slowly. Planes are for getting places, not seeing places. Take time to absorb the beauty and inspiration of a mountain or a cathedral. Travel expectantly. Every place you visit is like a surprise package to be opened. Untie the strings with an expectation of high adventure. Travel hopefully. To travel hopefully, wrote Robert Louis Stevenson, is better than to arrive. Travel humbly. Visit people and places with reverence and respect for their traditions and ways of life. Travel courteously. Consideration for your fellow travelers and your hosts will smooth the way through the most difficult days. Travel gratefully. Show appreciation for the many things that are being done by others for your enjoyment and comfort. Travel with curiosity. It is not how far you go, but how deeply you go that mines the gold of experience. Thoreau wrote a big book about tiny Walden Pond. Travel with imagination. As the old Spanish proverb puts it, he who would bring home the wealth of the Indies must carry the wealth of the Indies with him. Travel fearlessly. Banish worry and timidity. The world and its people belong to you just as you belong to the world. Travel relaxed. Make up your mind to have a good time. Travel patiently. It takes time to understand others, especially when there are barriers of language and culture. Keep flexible and adaptable to all situations. Travel with the spirit of a world citizen. You'll discover that people are basically much the same the world around. Be an ambassador of goodwill to all people. By taking the time to learn and to become comfortable in the art of travel, you will create an overall better experience. However, accidents still do happen. So, to continue on with prevention, I would like to talk about your mode of transportation. Whether you are on a motorcycle, a four-wheel drive vehicle, a 6 or 8-wheel military vehicle, you need to know the capacities of the vehicle, your limitations, and take training locally through the Overland Expo. Become very familiar with that vehicle, how it operates, and how to recover it if it does become stuck, or if you're on a motorcycle and it tips over, how are you going to upright it? All of these things can be practiced, it should be practiced, before you're out in the backcountry. Trip planning. Where are you going? And what route are you taking to get there? What's the weather going to be like en route? What's the weather going to be like when you're there? That all will make a difference with what you bring and what kind of conditions you will encounter. The next part of trip planning, who knows about your plan? Make sure that somebody has an itinerary so that there is a rough idea of generally where you will be and when you're expected to check in and when you're expected to be back. As far as learning to get medical training, there's a few classes that I would like to highlight. You can take a first aid CPR class, which is generally about a day, and that will give you the very basics on dealing with bleeding, putting pressure on wounds, doing CPR if somebody has a cardiac arrest, just the few basics. The next one I would like to highlight, the wilderness first aid, is generally a few days, and that gets more in depth into topics of dealing with first aid in the backcountry. The next one above that would be a wilderness first responder, and that's generally a little over a week, and that gets very in depth with a lot of scenarios on what to do if somebody gets hurt in the backcountry and there's a sustained amount of time that you would have to be with that person until help arrived. So those are really good classes to look up locally. Maybe you can travel with your mode of transportation to a class. Take that. It's a great learning opportunity. The next thing I would like to highlight are the 10 essentials that the Coconino County Search and Rescue highlights when they do preventative search and rescue training to individuals. The first on that list of 10 essentials is water. So make sure you have enough water if you're going for a hike, if you're on your motorcycle, if you're traveling via vehicle. Make sure you have enough for your entire trip, or a place to refill, and the capacity to carry extra. The second on the list of essentials is food. Again, make sure you have enough for the planned trip and then some extra. Number 3 is extra clothing. So depending on where you're going, what the weather is going to be like, if you're going to be out after dark, make sure you have enough clothes to sustain those temperature variances and the potentiality of moisture. And the next one is map and compass and GPS. So make sure you have those tools and you know how to use them. You can look up training online through Overland Expo, all sorts of training on map and compass, route finding, GPS. Number 5 on that essentials is a headlamp. So make sure you have a headlamp, even if you're not expected to be out after dark. Make sure you have that capacity in case you are. The 6th on that list is a first aid kit, and we'll cover that here shortly. Number 7 is a shelter or space blanket. So if you're on foot, you can carry something as small and light as a tiny emergency blanket. If you're on a vehicle and you have the capacity to carry more weight, you can carry a heavy duty blanket, and they come in bivy style, which is like a sleeping bag and still has the reflective properties built in that. Next is a fire starter kit and matches, and make sure that if you do start a warming fire in an emergency situation that you still observe good practice and dig down to mineral soil and make sure that there's no chance of it escaping to become a wildfire. Number 9, pocket knife and multi-tool. Those come in handy. And number 10, whistle and signal mirror. So if somebody is out looking for you on ground, you can use the whistle. If there's a helicopter trying to find you, the signal mirror will help them locate you. So those are the 10 essentials that the Coconino County Search Rescue recommends. As far as your group, you need to know who has allergies, who is taking medications. You can ask the people in your group if they get a headache, what do they take, if they have other issues and toothaches and anything common that they're dealing with and what they take, and make sure that they bring enough of those supplies in case they encounter anything like that during the trip. So from that, we'll move into some things to carry. I spend a lot of time on foot. I run in the canyon, and when I do that, I generally have a very lightweight water carrying vest, and I'll take about 10 feet of KT tape, roll it up real tight, and between that and an emergency blanket, flashlight, and a very small minimal of the 10 essentials, that's what I'm going to carry for first aid. That KT tape I can use for a sprained ankle. I can use if I get bumps and bruises and blisters, and it comes in handy in all sorts of situations. If I'm on my motorcycle, I'll have a kit in one of the side panniers, but then on my person, I'll carry a water carrying backpack with a few personal medical things, some blood stopper, tourniquet, some things. If I get thrown from the motorcycle, I'll have those critical first aid supplies right with me. If I'm in a vehicle, four-wheel drive vehicle, larger, and I have the capacity to carry more weight, I generally carry this bag and this bag. And between these two, I'll have enough supplies for any major injuries, blood stopping, just the basic injuries that you'll encounter potentially in the backcountry. So with those, I'll have lots of gauze and wound cleaning, blood stop, all the minor bumps and bruise, things to take care of those, tweezers and Coban. I carry, just in case somebody in the group or myself has a tooth issue, temporary tooth repair. Got the Oragel for toothaches. There'll be more supplies for wound cleaning. A lot of the general kits that you find that are pre-packaged, they'll generally come with some sort of manual for some basic first aid and some patient assessment forms. And these are really good to pull out of your pack when you buy a pre-manufactured kit and get to know them and spend some time with it before you actually need it and learn how to use that. And in those wilderness first aid, wilderness first responder classes, they'll go more in depth on how to utilize those tools. So that's a pretty basic overview of some first aid equipment that I carry. Next, I would like to go into the critical steps in case you have an injury. And a couple different things I'd like to highlight. When you're traveling, if you're going solo, you could be by yourself in the middle of the backcountry and somehow get an injury. And then you're dealing with just yourself. If you have a member of your party and you have multiple people that can help with one patient, that's going to be a whole lot better. Another scenario that could happen is you're driving on the freeway to an area that you're going to travel in, and you come across an accident, or even come across an accident in the backcountry. So the method that I'm going to describe is a variation in the wildland fire community. It's called a medical incident report, and it's a very specific list so that when that incident is reported, the other person who's receiving that information gets it very deliberately and very exact and knows what the situation is and what is needed to handle the situation. So I'm going to highlight a few things from that. First, and these are things that you can write down before you make contact with 911 if you have cell service, or through an inReach, whatever mode of communication you're able to use. So you want to be able to describe the scene. If it's a highway accident, an off-road vehicle accident, maybe it's at a campsite and somebody trips and falls into part of the fire and gets burned. If you're hiking on a trail, if there's a swarm of bees where you're camping or where you're out on foot, there's a multitude of different reasons why there's an issue. You want to be able to identify the number of patients. You want to be able to describe the obvious injuries or illnesses. The next category is, where on earth are you? So if you are on known streets and you can give the known street and the nearest cross street, that makes it very simple for 911 to send resources to your location. If you're on the highway, you want to give as accurate of a milepost as possible. So when I'm driving down I-40 or I-17 here in Arizona, I keep a close look at the milepost that I'm at, so if I did come across an accident, I would be able to describe more accurately where we are. If you are on a local, state, or federal off-road, there's going to be different road numbers that you'll want to know. And it's a good idea to know where you are on that road. So if you turn off of a main road, you can reset your odometer so that you can get an accurate mile in on that forest road. The next way to describe where you are is a latitude and longitude. And if you are going to use that, it is very good to be specific. So if you are giving a lat long in degrees, minutes, seconds, it seems very simple to say, but you want to actually articulate 35 degrees, 42 minutes, 53.62 seconds. And that way it's very, very specific. And if you just say all the numbers, sometimes the dispatchers don't know what method you're giving it in. What is the best method of transport for that patient? That's the next piece that's really important. So if the patient is severe enough that they need a helicopter, ask for that as soon as you possibly can. If ground transport is okay because it's a broken leg and it can be a delayed response, you can articulate that. And then the last thing is any special equipment that's needed. If the patient is trapped, as soon as you can articulate that extrication is needed, then the right resources will be sent sooner, and that situation will be taken care of at a faster rate. So if it's a vehicle that went off a road and is really far down an embankment, maybe they need a technical rescue rope team. So if you can identify those things, that really helps also. So something happens, you're en route to your destination, you come across an accident, you want to be able to describe what it is, articulate how many patients, articulate what kind of obvious injuries there are. You want to be able to describe accurately where you are, and then best method of transportation and any special equipment. So those are the critical things that you want to be able to articulate, whether you're on the 911 phone call or if you are using an inReach and you're able to communicate with the dispatcher that way. The last thing that I would like to talk about is what happens afterwards. It's very, very important that you take the time to process what you saw, what you dealt with, the people that were around. Make sure you talk to everybody and just be okay with what happened and be able to process that. And if you need to seek additional help, I highly recommend that. I have been in a multitude of situations where going to talk to a counselor because of a situation has really made a positive effect on my life and has made me able to keep adventuring and keep having fun and keep on going. So thank you very much and have a great day.